don't have really strong evidence about these treatments because those women were excluded from all randomized controlled trials. In the case reports collected and the overview and the few registries we have found, we didn't find a significant increase of complications or interstitial bleedings in the women treated. They were mostly treated women in the first 3 months of their pregnancy, and they didn't show a higher risk of bleeding, or vaginal or other bleeding, or abortion or pregnancy complications. Maybe a little bit higher, but it wasn't significant. It was not a large number. It was about 30 patients, so you can't really talk about the epidemiology. But as we concluded, and this is the important point, that you shouldn't withhold the treatment with IVT or intravenous thrombolysis or mechanical thrombectomy in those patients. So we suggested that you treat those patients with IV thrombolysis and endovascular treatment with mechanical thrombectomy. In the case they are eligible and they have no other indication that say you should withhold the treatment. And this is the next step, that you should not waste time in. It's a multidisciplinary decision, so you have to talk to the gynecologist or the others. So then you have to be fast and treat those women. This is also true, and this was also a neglected chapter for women during menstruation. We thought that they also somehow won't be treated. I think there are 5 cases described, and those had no major bleedings. I'm talking about major bleedings with a drop in hemoglobin or some other signs, and this could be that you can treat those, and then it's the days of the menstruation, but anyway, you shouldn't exclude them from treatment. And what we looked also at the postpartum period, and as defined 3 months after delivery, and we find the first cases after 7 days earliest after delivery. So you can't really say what happens the first 2 days after delivery or 3 days, which could be dangerous. But anyway, if the first week passes, then you could treat them. So it's not a strong recommendation because it's a low evidence or a very low evidence, or we can't really talk about evidence, but we can say we suggest it, not recommend it. But if they are eligible, we suggest treatment.